This is Surrogacy Unwrapped. Today's episode, medical screenings. What could come up?
Today's topic is issues that come up in med screening with gestational carriers, which are far more than people realize, I think. So really excited to kind of go over these because I think so many people need to hear about them because a lot of people, in my opinion, get real spooked by the things that can come up. And so it's really great.
Or they're really shocked when things do come up because I think that they just assume it's smooth sailing. And in a lot of cases it is.
Mm-hmm. Yeah, absolutely. So, this is just a good kind of informational sharing today.
Yeah, we don't want this to come across as scary or to freak you out. Knowledge is power. We just want you to feel informed and prepared for when you are going to have your medical screening. Even if you're an experienced surrogate, each medical screening could unveil new things that maybe you didn't experience the last time. Our body changes and goes through things with each pregnancy. And that's the whole purpose of this, is just to share things that we have seen happen over the years to help you know what to potentially expect.
Yeah, absolutely. So, Kristie, if you'll give us just like a brief overview of what is a medical clearance appointment, like at what point do you get to it? Maybe
Sure.
For someone who knows nothing about surrogacy, and then just kind of an overview of what it is.
Yes. So I think a lot of women may not exactly know when the heck the medical screening appointment happens. Logically, you may think that this would take place well before matching. You want to make sure your body's good to go, but actually this is the appointment that takes place after you've been matched because it needs to take place at the fertility clinic that the intended parents are utilizing, have worked with their physician, and have their embryos created at. And so this doesn't happen until right after matching and a confirmed match has taken place. Your agency is going to send over your records and your match information to the intended parents clinic. They're going to review all your history and then get you scheduled for an appointment. That can take a couple weeks depending on their scheduling process, their record reviewing process. So there can be a little bit of a delay from that point of match to the point of actually getting to your appointment. But once you're at this appointment, I will say it can vary by clinic. Some clinics jump right to an in-person actual appointment. Some clinics will set up a televisit first to get your medical history kind of underway and then have you come in for an in-person appointment. So I've seen that kind of vary across the field. But once you actually get to the clinic itself for that physical appointment, some things that you can expect are a physical exam, a whole host of lab work for you and your partner if you have one. It is important to know that your partner may be able to do labs at a clinic close to home if they can't join you. But if they can, then that kind of helps things go a little bit more smoothly. You get it one done all in one shot. The blood work is not only testing for like infectious diseases, STIs, but it's also checking for immunity to different viruses. We'll talk more about that. We are also having your hormone levels, like thyroid, checked at this point. There is going to be as I mentioned, a physical exam, and that physical exam is typically going to involve some type of a ultrasound, typically a saline ultrasound, which is going to be a check of your uterus to see if there's any fibroids, polyps, that kind of thing. And in real time, the doctor is able to typically give you some feedback on what they're seeing that day, but the lab work can take a couple of weeks to return back. And so there's going to be some kind of follow-up appointment. Generally, it's telemed again to give you the results and findings, if any were found, of your medical screening and hopefully issue medical clearance or tell you what was found and what needs to be done.
Yeah, absolutely. And I think you brought up a really good point with the saline ultrasound, that polyps and fibroids, those are things I feel like we're seeing all the time lately. And I think that people, just, I guess, tell us more about like how common those are and then what happens if they find one. Like, is it journey over? Then what?
No, so it shouldn't be over. Again, like Mariah said, this is happening a lot more, and I'm not a doctor. I'm not going to speculate like why this is occurring more frequently. There are definitely way smarter people out there in the world who have theories, and they may be right. I don't know, but it is something that I feel like we are seeing an increase of. Polyps are small, and they tend to be more common, in my opinion, than the fibroids. And these just naturally occur in a lot of women who've had children before. Typically, you're not having this type of testing done, when you're having your own children. So you may not know that these were already within you, or they developed after you had your own child. In order to be a surrogate, you've had to have a child before. So that just naturally increases your risk to these to occur. They're typically non-cancerous types of growths. And then the fibroids, they could be a little bit larger, but also, can easily typically be removed. So depending on the clinic and depending on the location of these polyps and fibroids, they're going to recommend removal if they believe it's going to cause any interaction or complication with the embryo transplant or the pregnancy itself. And so if a removal is suggested, that could cause a delay to your process, maybe roughly 4 to 8 weeks. And I'm calculating that time being for getting your appointment scheduled, having the procedure done itself, which the procedure itself is a hysteroscopy. And it is where they insert a really thin, like, device and to remove the polyp or the fibroid. It's very safe. It's outpatient. It requires little to no downtime. Recovery is really quick and minimally invasive. And typically what I see is they want the surrogate to have at least one full menstrual cycle before she can proceed with the embryo transfer itself. So I don't generally see people getting disqualified for these types of findings, but you should anticipate a small delay. And again, we are seeing this so much more recently and like occurring more frequently, so I wouldn't be terribly shocked if that's part of your results.
It's important to remember every clinic has different guidelines, and some require certain things, others don't. So it can vary from clinic to clinic. Sometimes even clinics will change their guidelines. So even if you are doing a second surrogacy journey, you've used this clinic before, oh, guess what? Now they do a hysteroscopy on every surrogate. So it just depends.
That's true. I've seen that happen before as well, but that's just kind of their standard procedure. So take everything that we're saying with like a grain of salt. We're making general assumptions of what we typically see, but to Whitney's point and what Mariah's saying, it's going to vary clinic to clinic. I can't project what every single clinic is going to do because there's just so many.
There sure are. And it's different sometimes from person to person. So really, it just depends. But, as you were talking about going back to the different screenings and things that they kind of will check, you discussed like thyroid and hormones. Hormones play such a huge role in this process altogether. So what kind of hormone level issues do we see come up in medical clearance appointments?
Yeah, so I feel like the biggest one that I see most commonly occur for women is thyroid. And again, I feel like that's a common issue for women, even outside of surrogacy world. Whether it's overactive or underactive, thyroids tend to play a role in our lives pretty often. And it actually can have an effect on your surrogacy journey. And so they are going to be testing that level. If they find that it is, again, under or over, they are going to likely start you on medication, supplementation to get that level to be where it needs to, as it can have an effect on the implantation and increase the miscarriage risk. So they're going to want to make sure we can get that to level out. Generally speaking, I don't see that that's a cause for a, disqualifying or canceling of a journey. It just creates a small delay while they're working on getting those labs retested and treating those hormone levels. Another one that kind of plays a factor throughout when you are preparing your body for the embryo transfer is your estrogen. It's part of your reproductive hormones and getting that uterine lining where we need it to be for your readiness for the embryo transfer. And so we just want to make sure that your body is ready to successfully take the embryo transfer. And grow that baby.
Yeah, absolutely. And with your thyroid, it's super important to make sure that like your body can tolerate the hormones that you're going to get, because this can have an impact if you do have an under or overactive thyroid. So of course, always the surrogate's safety and health and well-being is the number one priority, and we want to make sure that all of these things are in line and that it's going to be totally fine, which most of the time it is, but we want to make sure we catch it before it's too late.
Yeah, and the circumstances where I am thinking about the thyroid, if I'm not mistaken, the clinic tends to follow those levels. I feel like they even follow it during the actual pregnancy too. Maybe not so much the clinic at that point, but the provider who is maintaining the pregnancy. Just making sure that those levels are, being maintained and being monitored throughout the whole journey.
Yeah, absolutely. Another thing that we see are surrogates being told that they're no longer immune to things like rubella, hepatitis, measles, varicella. So why does this matter? How is it handled? Kind of what happens once you hear that? Because I feel like unless you're doing surrogacy, a lot of the times you don't know these things.
Yeah. Yeah. I mean, how often is that getting tested? I don't know.
Checked. Yeah.
Yeah. Maybe if you're like in the military or something and they
that's
you for everything, but otherwise, what else are you doing this in your life? And so that is something that we talk about, kicking it back to those match preferences in our last session. Like, are you willing to receive any necessary vaccinations? This includes even during your medical screening process. If they identify during your blood work that you are no longer immune to those various viruses that Mariah mentioned, are you willing to receive the booster vaccination in order to achieve immunity? And I suppose if you are not, then that could be an end to your journey with that clinic and that couple, because I don't believe like if the clinic standard is to have that immunity that they would proceed. With that said, if you are comfortable with achieving the immunity, getting the booster, I don't typically see this as a disqualifier, with the exception of perhaps, I feel like we did have one case where a surrogate's, like, she just wasn't showing immune. I could be wrong. Maybe I'm crazy, but I swear that there was someone who was not getting immune after having the booster. I don't know. Anyways, but you would have your lab work repeated, usually within 30 days. And at that point, you should have achieved immunity after receiving the booster. And then you should be able to proceed forward with the journey.
Yeah.
But you want to do this. Sorry, I didn't even answer really why. You want to do this because if you were to contract these infectious viruses while pregnant, it could be, one, harmful to you, but also harmful to the baby you're carrying, which is ultimately not the goal during this entire process.
Yes, absolutely. And I do see, I have actually seen before a case where the intended parents and the surrogate both didn't want vaccinations. And then the clinic said, actually, we won't work with you if you don't get vaccinated for these certain things. And in that case, I do think that they ended up getting vaccinated for like the bare minimum of what was required. But it does just depend, and these things do come up in med screening, even if it is a match point for you that you don't want that. Your clinic might decide they're the kind of the ultimate factor there.
I feel like I've also seen clinics have the intended parents and the surrogate sign like a waiver that talk to you about the risk of not achieving these immunities and getting these vaccinations, and y'all are choosing not to. Y'all need to sign this waiver that you understand that we talked about this and y'all made this decision. So I have seen it go a couple of ways.
Another med screening problem, and this one is a sensitive one that I hate having to discuss. Luckily, Kristie's in intake now, and I don't have to discuss it as much. So honestly, love that for me. But, BMI. So this is a sensitive topic, and there is scientific reasons behind it. I've been asked time and time again. I don't agree with the BMI scale. Sorry, my dog's gonna bark. I don't agree with the BMI scale. It's not the greatest, but unfortunately, there is kind of some science behind it. So can you kind of discuss why clinics care about BMI and what happens if someone is outside of the BMI range?
For sure. I totally agree with Mariah. I cannot stand having these conversations. And to her point, I am the one who has to initiate them and start them because I received the application. I see the height, the weight, the BMI to begin with, make note of it. Then we also have our surrogates go through an OB clearance appointment, which again gets a real time height and weight and BMI update. And unfortunately, we have to talk about this topic because it's going to come up at MedScreen. They are going to take your measurements of height and weight at the appointment. And if it's above their clinical standard of what they set at the clinic, which does vary clinic by clinic, on average, I feel like we're mainly in this 32 land of BMI. There are some clinics who may go a little bit closer to 34. But, you know, I would really highly recommend not being above the 32 mark for most clinics across the board. And again, whether we agree or disagree with how BMI is calculated, that's where we're at. And the reasoning behind it is there are studies showing that higher risk of BMI can increase the risk of pregnancy complications like gestational diabetes, hypertension, and issues during delivery. And there's even other additional research indicating that fertility medications could be less effective, and there could also be a reduced chance of a successful embryo transfer. And I know like your BMI may have been that when you had your own pregnancy, but unfortunately in these circumstances, it's just different. And if there is a great thing about BMI is it can be changed. And I don't say that lightly that it's easy. I mean, I've had my fair share with battling of weight. And so I'm not sitting here trying to say everyone can lose weight and become a surrogate because I know it's hard. But it is one of those things that to an extent is in our control that could be changed if becoming a surrogate is something you wanted to pursue. And there was nothing else, you know, obviously holding you back. And so when you go to the clinic, let's start back. If you apply, let's just say at Family Choice Surrogacy, and I see that your BMI is completely out of the range, and you can actually have a BMI that's too little or too less or the opposite end.
Too low, yeah.
Too low. I couldn't think of the right word.
Yeah.
Too less. Too low.
It's the end of the day.
But if I see that your BMI is out of the range, then depending on how far from that 32 window, I might let you know, like, hey, you need to pause. This is of concern. And again, knowing how difficult weight loss is, I may say, let's push things off a bit until you're closer to this mark. If you come at me and you're at 34, 33, 35, I will let you know, like, hey, you're within this window. You're so close. I need you to be aware of your BMI, especially leading into medical screening. They are going to take note. And I want you to be prepared for that and not like shocked and awed when that day comes. And then, you know, either I or the clinic, depending on if you make it to that point, are likely going to recommend, you know, lifestyle changes to help reduce your BMI leading into embryo transfer. They could potentially create a delay until you achieve their specific BMI standard at their clinic. But ideally, we as the agency wouldn't allow you to get to that point knowing what we know.
Yeah, and I think
set up for success.
we do, and we help support that, right? Like I've had several surrogates before that I am like coaching with, or I had a surrogate once. I loved it. It was kind of one of my favorite things that I've got to do is we both of us needed to reach more steps per day. And, you know, we want to make sure that you're losing that weight in a healthy manner. We never want you going to extremes. We never want you doing like extreme dieting or anything that's going to put you in an unhealthy space. So I had like a step challenge with this surrogate, and every day we'd send each other pictures of our watch, like, hey, I got 10,000 steps. Did you get 10,000 steps? And it'd be like into the night, and we'd be like, oh, I need 200 steps more. I'm going to go walk my hall up and down. And so it's just like, it was kind of really fun. And I try to make it like that because BMI just really is one of those things that, again, it sucks and we don't like it, but there is science to show that the efficacy of the IVF meds is more effective with lower BMI bodies. So that's just, you know, if that is a feedback piece that you get, don't think it's the end of your road. Don't be too disheartened. And if you need help, because not everybody has always had to lose weight.
Right.
Some people have never had to lose weight throughout their entire life and they don't necessarily know how to. So please reach out. Like, we're here to support that in any way. And again, we want it to be in the healthiest way possible.
And I think there's some support groups, Facebook groups, if I'm not mistaken, related to surrogacy and BMI and weight loss and getting healthy. I can't think of any specific names of the groups this very second, but I feel like there are at least one of them out there that I've seen across the groups before, that other women can support each other with too, in a bigger group setting where everybody's collectively wanting to be a surrogate and is held back by this. And I think there's, power in numbers and like you just having that support system. So I encourage for sure.
But anyways, the next one that we see kind of regularly are antibody issues. So this one is kind of interesting, but what happens if a surrogate has certain antibodies in her blood?
Yeah. So I think the most common one that people would be able to relate with, or at least maybe have heard in their life, is the Rh factor. So if a surrogate's blood type is negative and she has developed antibodies against a positive blood type from a past pregnancy, it could create risk with the embryo. This doesn't necessarily mean that you can't be a surrogate or that your journey is done. It just means that we know this now about you and that we need to make sure we're matching appropriately, and matching with intended parents who have an embryo that wouldn't react against your antibodies, and taking other safety measures. We have had another surrogate in our agency who had a different type of antibody, and one that I'd never even heard of. But anyways, we had to find very specific intended parents who would be able to match with the person who had that, and they had to be willing to do labs prior to solidifying that match, that they could actually move forward together. So in my heart of hearts, I believe there's a match out there for everyone. And if it's something that can be done, it may take some additional time, but I think we could find you a match. So I wouldn't get disheartened by that either. Again, knowledge is power. And so knowing this information is only meant to help keep you safe and protected, give the intended parents the best outcome and chance for success with their precious embryo. And, just finding the right match to keep everyone safe and healthy. Other things, autoimmune type issues and infections or antibodies that can come from that. Just, again, knowing more about your body, your blood, and how it could affect a future pregnancy.
Yeah.
And a lot of that's really complicated for me, but that's why we have great doctors who help explain all this.
Yes, we do. And boy, do I not envy them most days.
Yeah.
Yeah, and then, other less common surprises that could come up during screening. Like, what are other things that we see, that are kind of strange and wouldn't come up in your normal, like, just regular well check with your PCN?
So most of our surrogates will have had a updated PAP prior to going to med screening, but say for whatever reason you didn't have one updated and it was updated maybe at med screening, if an abnormal PAP were to show up, that could potentially cause a delay, and it could disqualify depending on what the results were of that abnormal PAP, and what testing and treatment may have had or need to happen because of those results. Uterine scarring, so this could be from past surgery, C-section, D&C, etc. When they're doing their testing and their ultrasounds, if they see that you have a lot of uterine scarring, that could create issues for the implantation with the embryo transfer. It could require some type of surgery to maybe lessen or reduce that scar tissue that they may have found. That could result in a disqualification depending on what they're seeing and the severity of it. And you may not have known anything about that until this moment. You just don't know and what you don't know.
Yeah.
And then if during your screening, your lab work came back positive for any infectious diseases like HIV, hepatitis, those could be pretty serious risk for a pregnancy, and that would be probably a hard stop right there as well of being able to move forward given our guidelines.
Yeah, but I think, it's important to note that this med screening is in place for a reason. And truly, it's here to ensure that you are safe to move forward, that your surrogate, if you're an intended parent, that your surrogate is able to move forward in a safe manner and carry a pregnancy safely, that there's not risks that make her, or they're not factors that make her higher risk for things like preterm labor or any of the things that we really don't want in a pregnancy. So
Yeah.
all of this is here to protect all parties.
Mm-hmm. And I think it's important to know too, as the agency, if you go the agency route, like us as the agency, we are doing everything that we can to pre-qualify, to make sure that she's meeting the basic recommendations and qualifications to become a surrogate. We are going through her records and her pregnancy history. We're getting that OB clearance. These deeper dive testing, like these specific things that we've been talking about tonight, those have to happen at the fertility clinic, at your specific fertility clinic, based on your doctor's protocols for a successful chance of pregnancy, via surrogacy. And so we are doing everything that we possibly can outside of those actual things to make sure that once she is there having her medical screening, she should be approved to move forward. And then if these additional things show a red flag or a concern, hopefully they're minimal and easy to fix, and she is able to then proceed.
Yeah, I think that's, like you said, a lot of these issues are treatable. A lot of times they don't even show up.
Yeah.
But if something does come up, it's merely a speed bump. It doesn't
Yes.
mean it's the end of the journey.
And those speed bumps are hard. Like, I don't want to make people, I don't know. I hate to feel like I don't know, like I know we see it all the time and maybe we're desensitized. Like, I get it. Those speed bumps suck. And
Yeah.
I understand a delay is a delay and it is hurtful when you've been waiting for so long. And even on the surrogate side, I know, she has a life and the things that she wants to get onto, and she projected surrogacy taking, XYZ amount of time. I get it. And so I don't want to minimize the speed bump or the delay. I get it. It's rough. But it will most times move on and get on to the good stuff.
Yeah. Well, and for me too, as having been a surrogate,
Yeah.
like you're attached and emotionally invested in this process too. So it sucks because your intended parents are bummed and they're bummed. And then there's this weirdness sometimes when things come up in med screening, like, oh, stupid body, like, oh, my uterine lining. And it's like, you couldn't do anything about your uterine lining.
No.
Like, why are you, and
how many times have you seen your uterine lining?
yeah, exactly. Like, we'll sit and talk. And I had a surrogate the other day tell me, my ovaries are doing too much. They're doing too much. And she was like, it's so frustrating. And I'm like, there is literally nothing you can do about that. That's all doctor things and meds and,
And how many times have we seen their menstrual cycles be delayed when they have never once had a delayed cycle just because they want it so bad so they can go to their medical screening appointment?
Yep. I always ask on the, whatever day. I love when I always start on the 6th of every month. And the 6th comes and I'm like, hey, anything? Nope. 7th. Nope. 8th. Nope. I'm like, it's because we knew it was coming.
Yeah. We have too much pressure on our body and our body knows. How fast do you typically get the results after the screening day? Would you like to answer that?
Yeah, good question. No, I can answer that. So usually after the in-person screening, and this will kind of vary from clinic to clinic, but usually about 10 business days, so 2 weeks, is your kind of turnaround time. That's when we set our follow-up for to be like, hey, have we heard anything? And then, so yeah, usually about 2 weeks for results. And then if there's any findings, sometimes an additional, oh, we need a follow-up test, or oh, we need one more ultrasound or whatever, then you kind of go from there.
Yeah, usually they'll give you some feedback of like the physical things they saw that day, just to give you some kind of guidance. Like if they did find a polyp, you typically will know that same day of medical screening. But the labs and such, like Mariah said, tend to take those two weeks to get results on average.
We do oftentimes start our surrogates when they sign up with us on vitamin D, because that is one of the biggest ones that I see from clinics is, hey, her vitamin D levels are low. And there was a clinic a while back notorious for being like, her vitamin D levels are low. We're going to have her take vitamin D for 3 weeks and then retest.
Mm-hmm.
And it's like, that could have been avoided. So now we just kind of preemptively do that. If anybody has anything they'd love to see addressed, please feel free to DM me or our Family Choice Surrogacy page, or Kristie, or I don't care, send it, carrier pigeon, send it however you want.
I love that.
Would love to hear. I would love to get a carrier pigeon.
That would be amazing.
That would be so cool. I don't know why we went away from that. We really appreciate you watching. Kristie and I love doing these, and we hope that you guys find a benefit from them as well. And if there's any topics you would really like to see covered, we would also love to hear that.
If there's something that is deep and weighing on your heart, let us know. Would love to share and, connect with you on it. And again, all the things we talked about today, I'm not trying to scare you. Doesn't mean your medical screening is going to be big, bad, and scary, and all these things are going to happen to you, and you need to be panicked and causing your cycle to be even more late because of all your nerves. It's going to be okay.
This is what we're here for. This is what
Yes.
we're here. We're here to guide you through it, kind of talk you through it. And hey, if there's a delay, there's a delay.
Yes.
It is not the most ideal situation, but we'll get you through it.
That's right. We got a team of support here for you, and all we're here is just trying to give you knowledge, because knowledge is power. The more you know. And so we are super excited, and feel free to connect with us whenever you need anything. So have a good night.